Hi, Dr. Komal. You can place first page of your PPT.
Okay, I'll be sharing my screen right now, and
Yeah.
just give me a cue if I have to start beginning right now. If everybody has joined, I'll just start.
Okay.
Okay. So good evening, everyone. My name is Dr. Komal Jha. I have been allotted this session with you guys today on the topic of the silent killers, that is diabetes, hypertension or BP, and cholesterol. We will be going through a comprehensive guide to understanding these health parameters, detecting hidden metabolic risks, and reversing chronic conditions. This is a preventative healthcare masterclass, and as much as I have tried to concise almost all the health parameters and their hidden reasonings and risks in this PowerPoint presentation, so I would request you to please pay attention, and any questions that you have will be welcomed at the end of the session. So these are the topics that I have divided this masterclass into. That is health parameters. So these are basically biological metrics and parameters, difference between normal and abnormal ranges, and early detection concepts. So here I will be telling you how to decipher through a reported imaging of what is a normal BP or a normal cholesterol level and an abnormal ranges of all these parameters, so that whenever you have any reporting or any appointment with the doctor and you get a lot of clinical tests to be done, so before going with forward with that, you can actually assess on a individual basis what is a normal and abnormal ranges, because even if you do not belong to a healthcare background, I think it is very essential for you to read basic reports that almost all physicians are now prescribing. Second part is divided into vital signs, that is blood pressure, heart rate, SpO2, temperature, and respiration mechanics. These are basically vital signs of the body that have been obviously in any hospital you will be going, and there will be some electrodes or something attached to your body, sphygmomanometer attached to your body, to read certain parameters that decipher what kind of health state you are on the basis of how you present to a doctor. So these presenting parameters are basically called vital signs. This will give you an individual exact basis of how the patient or how the person that is presenting to a hospital is actually assessed and is being assigned to a hospital, or is if in need of care or not. The third is blood pressure. So third is blood sugar and lipids. That is, we'll be discussing a little about insulin resistance, HbA1c, and how it is different from FBS and postprandial systemic glucose pathways, cholesterol and triglycerides. And the last part will be metabolic syndromes. That will be an interconnected matrix of chronic diseases and multi-organ risk cascades. So I don't know if you guys know about it, but what exactly are metabolic syndromes? I feel like we should discuss that before we start anything. So I hope so women who have attended this session today now understand that PCOS is now renamed as PMOS. That is one of a metabolic syndrome that is associated with insulin resistance. There's something also called atherosclerosis, which intent of people have hypertension or heart diseases, they start to develop it early on. So this is one of the thing. People who consume alcohol increase fat in diet, they have a tendency of developing ALD, that is alcoholic liver disease. So every time you go to any ultrasound and you have a fatty liver, that is one of the primitive signs of developing ALD. So this is why metabolic syndrome is also one of the factors that we need to discuss if we are giving our time to discuss everything else. So what are health parameters and why do they matter? So these are basically quantifiable biomarkers. They are a physical and chemical indicator of your cellular health. So on an atomic level, everything in your body is generated from cells, and everything that happens inside the cells that can be assessed with minimum CBCs and certain biochemical tests that almost all physicians are nowadays prescribing. And these are also included in a full body health checkup. Those are not added just for the sake of it. These are very much important for a quantifiable biomarker of how your physical and chemical health on an organic basis, on a cellular basis, happens inside your body. And second is homeostasis indicators. These are basically how the essential organs of your body, that is your heart, liver, pancreas, kidneys, they function together to make an efficient, healthy body. So, to make an equilibrium between all of these systems, it's important that you know the health parameters. Window to subclinical disease. So, there's something called an iceberg phenomenon. I don't know if many people know it or not. So, let's just discuss that. So, anyone who has seen the movie Titanic would obviously understand what an iceberg is. An iceberg that is visible to the naked eye seems very small, but it is actually a very huge structure from the depth of the sea to the pointing of the skies. So, basically, diseases or clinical diseases that are actually coming under silent killers, they show iceberg phenomenon. So, whenever the tip of the iceberg is visible, that is when you have developed the disease. But there are certain signs that you cannot see, for which these quantifiable biomarkers are very much required. This stage where you cannot see the parameters of the disease, the manifestations of the disease on your body, but on a cellular level, there is organ damage happening, is called the subclinical state. So अगर कोई भी डिजीज फॉर दैट मैटर, इवन कैंसर फॉर दैट मैटर, अगर इस स्टेज में डायग्नोस हो जाता है, so you have a 80 to 90% chance of actually reversing the disease. Having said that, if it goes towards the clinical stage, that is the stage where you can actually see the manifestations of the disease, then the capacity of reducing the manifestations of the disease decreases exponentially. And that is why discussing the iceberg phenomenon when it comes to silent killers like hypertension, diabetes mellitus, and ALD, PMOs is very much important, because these subclinical signs cannot be assessed without actually knowing what the health parameters are actually saying. So these are personalized risk baselines. So the risk baseline can be assessed on the basis of how and what these diseases are presenting you. So as I say this to everyone, almost everyone who presents to the OPDs to our hospitals, you cannot manage what you cannot measure or which you do not measure. So health parameters are the real-time diagnostic dashboard of your internal biology. So this is why it's very important that we go through health parameters, and this is the reason why they matter. Biomarkers versus symptoms, the early warning gap. So as I discussed the iceberg phenomenon, the difference between the clinical stage and the subclinical stage is where the early warning gap comes in. This is the division. So objective biomarkers like blood pressure readings, HbA1c, that is 3 months, how your sugar levels are, fasting insulin, lipid profiles, give early diagnostic evidence at stage 0 or stage 1 of a disease, from where reversing the manifestation of the disease is very, very, very easy. But once it goes into a pathological state where it starts affecting your organs, then it kind of becomes very difficult. And then and there is the reason where only lifestyle changes will not help you. Then you are put on certain medications and certain pills which you have to take for probably a very long period of time, or probably for lifelong. So to avoid that, the early warning gap or the difference between a biomarker and a symptomology is very important. Subjective symptoms like angina, that is chest pain with palpitations, dizziness, chronic fatigue, and blurred vision appear only after 50% to 70% structural tissue damage has already occurred. So these symptoms and manifestations will start when the person or the patient is transferring from a subclinical stage to a clinical stage. So the silent epidemic impact in numbers. So subclinical damage without warning, like high blood pressure, elevated blood sugar, and arterial lipid buildup, progress quietly over decades without causing any physical discomfort. Hence, it is called a silent epidemic, because there will be no symptoms or manifestations that a person will ever be able to identify that you are going to develop hypertension or diabetes mellitus. What you can do is that go through a regular health checkup or go through a regular body checkups done by anywhere, like from your individual basis, or if your companies provide it, to actually assess and align if you are one of the risk categories or risk factors to develop certain diseases. Over 1.28 billion adults globally suffer from hypertension, and nearly 50% are completely unaware of their condition. Routine screening is the only defense against silent metabolic degradation. So I feel like today morning I was on rounds, and one of a patient that is admitted in one of the departments is sending us a referral for increased FBS. That is, the FBS, that is fasting blood sugar, was around 158, which is quite high. And for some reason, looking at the patient and seeing the symptoms of the patient, I assigned, let's get a TSH or pre-thyroid done. And it turns out the patient was also hyperthyroid for the past 5 years. And it was detected only when we went for a referral for sugars. So there are certain diseases that you won't even understand or know that you have unless and until you go through a lot of health parameters, regular checking, so that you understand that there are certain cellular organ damages that happen without any clinical symptoms or clinical design or metabolic degradation, which will be only assessed if you understand why assessing the overall health requires a lot of biological parameters. So it is not just sugars that you have to take into control. There are so many other hormones in the body that you have to assess and keep on assessing at least minimum 6 to 8 months के बीच में. So silent diseases, why you may feel fine but aren't. So lack of internal pain receptors. So blood vessels, liver tissue, kidney infiltrations unit lack sensory pain nerve endings. Micro injuries accumulate silently for years with zero pain signals. So these are the kind of organs that don't have any nerve endings or sensory pain endings. So anything that are happening in these particular organs are not going to visualize or be felt by your body, or it's not going to send any sort of symptoms or any signals to your brain to actually realize that, okay, there is some organ degradation happening. So this will continue over 10 years, 20 years, and then later on, when you have complete manifestations or complete accessation of the disease, you will understand that there is not only hypertension, but also maybe atherosclerosis or certain heart diseases that you have developed. And many people who come to the hospital, they actually come after the end organ damage has already begun. Nobody in their early 30s has ever come to a hospital and said that I want to get assessed for a cardiac thing or a kidney manifestation. They will probably come for increased sugars or probably chronic fatigue or blood division or something like that. But nobody ever actually comes for heart manifestations or kidney manifestations or liver tissue are damaged or anything like that. That is because these manifestations happen over a long period of time. And by the time the chronic pathology starts in your body, it is quite late. And then you have to probably take a lot of medications and give up a lot of lifestyle changes, you have to accept new lifestyle changes and give up a chronic use of lifestyles that you were practicing for a really long time to actually reverse. And sometimes even doing that is not going to help. So this is why asymptomatic compensation is very much important, because the body compensates arteries, stiffen, cardiac muscle enlarge to maintain output. And these all happen over a period of 10 to 20 years. These don't happen in a matter of months. So hiding disease progression until organ breaking points are reached. So this will happen probably at the age of 40 to 50 years of age. So that is why many people from the age of 25 to 30 now are getting very much accessible and very much interested in putting health as a priority. Whether it's assigning into yoga classes or Pilates or giving up sugar or never eating out more than once a week or doing these marathons like High Rocks or Ironman. These are nothing but people who are in their 25 and 30s and are actually seeing their parents or their grandparents struggling with their health, are getting very much interested in health in this matter, because there is a lot of asymptomatic compensation that happens on decades, and they don't want to wait till their 40s and 50s to actually understand that they have developed certain calamities that is going to take up a lot of their time and money or finances to reverse. So, gradual habituation, low energy, mild headaches, and fatigue develop so slowly over years that patients accept them as normal aging rather than warnings of high BP or sugar. Symptoms equate late stage. Physical pain, angina, or vision changes occur only after 50 to 70 of vascular or organ capacity is lost. So, biomarker screening is the only early defense that you can actually practice. Vital signs, the body's immediate signal. So these are the immediate signals or vital parameters of the body that I feel like, if every time, if even in COVID, if you know the pulse oximeter everybody had bought in their homes, they had heart rate and oxygen saturation, temperature thermometers, respiration rate or respiratory rate, BP. Everybody, I probably should have a sphygmomanometer at home or a digital sphygmomanometer at home. So those are nothing but the vital signs. These will give you a early onset or let's say a immediate indicate of what your health looks like at a particular aspect of time. But these are not always associated with chronic diseases. People with BP, they might present with normal BP, but that is only because at that particular instance of time they might not be under a chronic stress. Or someone who has probably pneumonia 3 months back might present with an oxygen saturation of 98. Bronchial asthma might present with an oxygen saturation of 98. But these health parameters are basically immediate with a specific ounceity of time. They cannot be given as a biomarker indicator of what your overall health is. But yes, obviously, if you are coming to any hospital or presenting yourself to any OPDs, these are the basic functional vital parameters that any doctor for that matter, or even a nursing staff or any healthcare personnel will definitely detect. So one by one, we are going through all the health parameters or vital parameters. So first is blood pressure or engine pressure of life. So blood pressure is determined by cardiac output multiplied by systemic muscular resistance or vascular resistance. So BP, this is the basic formula of having BP. This is very medical, but basically heart has four chambers, atriums and ventricles. So one side we get all the venous blood or the blood that is thrown out of by the body. These are the deoxygenated blood. And one side we have the oxygenated blood or the arterial blood, which is basically nutrient rich and will be used by almost all your tissue and organs to actually function the body. So these will have some certain SA nodes, AV nodes, bundle of His, and these are made by these small fibers called cardiac muscles. Even though these fibers are extremely small, these are one of the most resistant fibers that start at, these are the muscles that start at probably 6 to 8 weeks of life when you are inside your mother's womb. And these are the muscles that stop the last when you die. So these are the most systemically vascular resistant muscles and the most activated muscles also. They never stop working. So that is why I probably the heart requires the most nutrient, and that is why it is given the essential responsibility of dividing deoxygenated and oxygenated, or nutrient rich and non-nutrient rich blood. So these start with the factor of blood pressure, these assignment of blood pressure, because the pressure inside of these muscles actually help in coiling or recoiling these muscles so that the blood can be thrown out with a propulsion. And if this propulsion is not generated by the heart properly, the arteries or the venous blood, let's just leave that, but the arteries don't have any factors in them that generate pressure. So the arteries that are carrying the nutrient rich blood is completely dependent on the heart's recoiling pressure so that they can throw the blood into vital organs. Because venous blood में they have deoxygenated blood, उसको तो सिर्फ बॉडी से उस ब्लड को बाहर फेंकना है. So they don't require that much pressure inside them. They don't require that much recoiling inside them because the blood is not going to be used by the body anyway. But having said that, you have to understand that the arterial blood, they have a lot of use. This is where your blood pressure comes into. The blood pressure that people keep talking about is probably the arterial compliance or the recoiling power of every human heart, which comes with every heartbeat. So this loss of arterial elasticity sharply elevates vascular resistance, and that happens when the BP significantly increases to an exponential amount, causing stiffening of these blood vessels. For that matter, let's just understand the blood pressure reference ranges. Then I will go back to the slide behind. So whenever someone comes into your home or probably any hospital and say that my BP is coming, say 140 by 80. So diastolic and systemic or systolic pressures have been divided by any clinician to understand which person or which automatic population is probably coming with a stage of hypertension where it is reversible and where it is into a hypertensive crisis where whatever medications that we give is not going to probably stop the end organ damage. So probably these two stages are the places where hypertensive people are given medications and lifestyle modification to reverse hypertension. Having said that, once you reach this stage, there is no way that without getting admitted inside an ICU or probably going through a rigorous treatment of a lot of IV drugs, you're going to probably reverse from this condition. Hypertensive emergency or hypertensive crisis or hypertensive urgency is a immediate causation of admission in any hospital. So this is probably one of the things that you have to absolutely take as an emergency. This is not something that we are going to discuss because this doesn't come under subclinical stage. This is where your manifestations have already begun. You are already in end organ damage. So this is completely an emergency. You have to get hospitalized. You have to get an IV drug. You have to get amiodarone. You have to get everything. You have to get your heart checked. You have to get your brain checked. You have to get ruled out for stroke. You have to get ruled out for EMI. You have to get ruled out for strokes and cardiac arrest. Everything. So this is the probably stage where you have already you have reached the end stage. But you have to understand the elevated hypertension stage 1 and hypertension stage 2 is where most patients come to a doctor and they are in a place where they are moving towards end organ damage and there is a 90% chance that they can reverse it by either lifestyle shift, medical action, or both. So anyone who comes with a systolic BP, and with here I would say that the diastolic BP is always given more preference over systolic BP, because systolic BP is basically a culmination of venous and arterial blood. So we don't take that into consideration always, because these jump high and low all the time depending on your stress levels. But diastolic is completely your arterial blood. So this is basically giving the recoiling power of the heart. So once this starts increasing, that means muscles are going into stiffening. क्योंकि कोई भी मसल को अगर बहुत ज्यादा वर्क करना पड़े या ओवर वर्क करना पड़े तो इट विल गो इनटू स्टिफनेस, वेदर इट्स एन हार्ट मसल, वेदर इट्स योर नॉर्मल body muscles, whether it's your upper limb muscles, lower limb muscles, whether it's your eye muscles, anything. Even eye muscles, when you see a lot of screen, people will come with mycomia, जिसको बोलते हैं ना कि मेरी दाई आंख फड़क रही है या फिर बाई आंख फड़क रही है एंड कुछ अच्छा होने वाला है, बुरा होने वाला है. From your perspective or spiritual perspective, people say that, but in our medical terms that is called mycomia. That is because you're using a lot of your screen, you're using a lot of your eyes. So कोई भी muscle, for that matter, the body is entirely muscles and water. So कोई भी muscle, if it is overworked, is going to cause a little bit of stiffening, and that is also applicable to your heart. So 120 to 129 systolic blood ranges are considered elevated. 130 to 139 is hypertension stage 1. 140 or higher is hypertension stage 2. And hypertensive crisis, I already told you, it's end organ damage. You have to get admitted. There's nothing else we can do. Diastolic, less than 80, not that much bad. 80 to 89 is hypertension stage 1. 90 or higher, hypertension stage 2, that is you are going towards end organ damage, and more than 120 is hypertensive crisis, that is hypertensive urgency. As I said, it is an emergency thing, you have to get admitted. So this is very much important that people understand the ranges of blood pressure, because you can't systemically go to any doctor and say I have a BP of 160 to 90. This 90 is not good, and this is only understood by you if you understand what parameters you're looking at. Even if 160 is bad, 90 is very bad, because diastolic is always given more importance over systolic. So always pay attention to whatever your diastolic pressure is. If it is coming more than your systolic pressure, leave everything behind. Please go and see a doctor or start any medications. And especially people who have a very chronic stress job, they should definitely pay attention to this table. So this we have already discussed. I'll be moving forward now. Heart rate or pulse. This is the cardiac efficiency. So heart rate indicates ANS, that is autonomic nervous system balance and cardiovascular conditioning. This is basically all the sympathetic or electrical channels must be functioning. This is probably the place where I need you to understand that heart. Does anyone understand why people go through like pacemakers or something like that? So let me just go that diagram again. Since a lot of people who are attending today probably will be at the age of more than 40 to 50, or they might be at the age of 25 or 30, but they have seen their grandparents getting pacemaker. So they should understand what heart rate is and why do you require pacemakers. हमारी हार्ट में ना कुछ इलेक्ट्रिकल इम्पल्सेस जाते हैं which get carried between the bundle of His and these SA and AV nodes. जब भी किसी भी क्रॉनिक पेशेंट का बीपी बहुत हाई हो जाता है, मसल स्टिफनिंग की वजह से देयर इज अ ब्रेकेज बिटवीन दीज इलेक्ट्रिकल पाथवेज. इससे होता है हमारा हार्ट रेट ऊपर नीचे, दैट इज योर पल्स गेट्स ऊपर नीचे, क्योंकि उस इलेक्ट्रिकल सिग्नलिंग के बीच में गैप्स आ रहे हैं, बिकॉज आपकी मसल स्टिफन कर रही है, बिकॉज यू हैव हाई ब्लड प्रेशर. Then these people develops certain kind of palpitations, angina, fatigue, बेहोशी, chronically चक्कर आ जाता है, गिर जाते हैं. सांस फूलती है, कोई डिस्टेंस जाने पे सांस फूलने लगती है. That is where you have to get an ECG done. Chronic hypertensive patients, definitely if these symptoms are coming into your life, that means you have to get your pulse rate and electrical impulses checked. That is why you require a pacemaker to maintain the pace of the heart. Pacemakers are nothing but machines that are put inside your heart so that these electrical impulses के बीच में जो gaps आ रहे थे वो उस gaps को make up कर सके. Many people don't understand what or क्यों systemically a lot of रिकवरी और बहुत सारी ऐसी मशीन्स या फिर बहुत सारी ऐसी चीजें मेडिकेशंस में या फिर प्रोसीजर सर्जिकल प्रोसीजर्स में लोग आए दिन कराते हैं बट दे डोंट अंडरस्टैंड इसका नीड क्या होता है. सो व्हाई एवरीथिंग इज इंटर रिलेटेड एंड व्हाई हार्ट रेट पल्स योर कार्डियक आउटपुट HRV एवरीथिंग इज रिलेटेड. ये जानने से पहले you have to understand ki why these things are important for you, and when you ignore these things is when you have to start doing all the surgical procedures like pacemakers and everything. So if you have high blood pressure, you are not only going into heart problems but also might require a pacemaker also in the future, might require stroke protocols in the future. So everything you see is interrelated. It's not just BP. It's not just the fact that you're taking Telma or amlodipine. It's everything. Your every overall health system is related to all these parameters. So bradycardia and tachycardia are medical terms. Basically, bradycardia is 50 से less अगर आपका beats per minute है, so that goes into bradycardia, and 100 से above is considered tachycardia. But these are vital parameters that are not always considered to a disease pathology, because endurance athletes or people who actually are very agile or physical, even gymnasts, ballerinas, inka resting heart rate is only less than 50, because their heart is into the normal state of pumping more blood because they are into endurance sports or endurance athletes. And tachycardia is something that is obviously related to sympathetic overactivity. It can be related to stress or any pathology. So we should know the normal ranges, but इसका मतलब हमेशा ये नहीं होता है कि like you have some sort of pathology, but definitely you should understand कि heart rate का मतलब क्या होता है and how you can read it, and if heart rate is chronically going ऊपर and नीचे तो क्या problem होती है, that is your electrical impulses are not probably going inside your heart. Body temperature and respiration mechanics. So body temperature is regulated by hypothalamus. Hypothalamus is very sensitive to pressure and temperature both. It is also very sensitive to insulin when it comes to hormones, TSH or thyroid, ghrelin, that is hunger hormone. So let's just discuss all these three. So hypothalamus is sensitive to your insulin, TSH, and ghrelin. That is why body temperature is also a related trademark for people who have thyroid deficiency or diabetes. And अगर आपको बहुत chronic starvation में, if you understand what the protests were or something like that, Sonam Wangchuk was having a chronic um, temperature of very high, like cold temperature, cold extremities. That is because his body was going into starvation. People who have diabetes mellitus, they feel a lot of cold. People who have thyroid, they feel hot, extreme hot or cold. So this is very interrelated to whatever your body and insulin or whatever your hormones are saying. So I really like how the body functions in these parameters, because just by one parameter or one vital organ, everything that is there in your body can be read if you know what you are reading. If you know what you're going through, if you know what you have to read, almost everything in your functional body is interrelated. There is nothing in this human body that is not interrelated to each other. So it is one of the most dynamic and beautiful creations of God. So oxygen saturation, hemoglobin, oxygen saturation. I think COVID, a lot of people had pulse oximeter. Pulse oximetry is nothing but your लंग्स में जो एल्वियोलाई होते हैं उसमें कितना ऑक्सीजन कैपेसिटी एब्जॉर्ब हो रहा है एंड कितना ब्लड में जा रहा है. दैट इज द ओनली रीजन व्हाई कोविड में पल्स ऑक्सीमीटर वाज एक्चुअली इन एवरीवन्स हैंड, so that they can understand the amount of oxygen that they're taking is actually reaching the nutrient, the organs or not, it is actually going through your blood or not. And people who are having a chronic less 70 to 80% of SpO2 were getting admitted. Does anybody know why COVID में इतनी deaths हुई थी? Did anyone like go and find out कि क्या actually में होता था? Why लो SpO2 की वजह से लोग एडमिट हो रहे थे? क्योंकि ऐसा तो नहीं हो सकता कि सिर्फ SpO2 लो होने की वजह से, फीवर होने की वजह से इट वाज सच अ बिग मैनिफेस्टेशन कि लोग एडमिट हो रहे थे. कोविड का जो वायरस था, it was destroying the alveoli of your lungs. That is the reason why everyone was going behind pulse oximetry. And there were like I was in my internship when COVID happened, and I have never in my life, and I never want to see in my life this many deaths in my life. I have never seen, and I don't want to ever see that. But there was only one cause of death almost all the people had, and किसी भी क्लिनिशियन से या फिर किसी भी इंसान से पूछने की जरूरत नहीं है, बट आई थिंक नोबडी इवन टोल्ड पीपल व्हाई पीपल आर डाइंग, बट इट इज समथिंग कॉल्ड DAD or DAD, that is diffuse alveolar damage. This is the sole factor why 1.3 billion people died during COVID, because this virus was basically relatively destroying all the alveoli of your lung. And lungs में alveoli are the only the atomic level पे जो भी functions होता है alveoli का, उसी के थ्रू आपके ऑक्सीजन अंदर जाके gets mixed with your blood and gets into your organs. So this virus particularly was damaging the alveoli, and that is why diffuse alveolar damage की वजह से there were so many deaths. This is the reason why COVID was considered to be one of the more biggest fatalities, human fatalities after the Spanish flu. Spanish flu में भी same ही था, the virus was destroying the alveoli. This is the reason why now SpO2 or hemoglobin saturation, oxygen saturation has been added into the vital parameters. पहले we used to only take BP, heart rate, and temperature. So after COVID, SpO2 also became one of the vital parameters. Blood sugar dynamics from intake to energy. So glucose is the primary metabolic fuel for cellular energy. Anytime you're feeling dizzy or low in energy, eat a protein bar, eat something sweet, you will have instant energy. So because digested carbohydrates, they enter bloodstream as monosaccharides, which are very easily soluble in blood. So there are certain pancreas in our body, pancreatic beta cells and alpha cells. Alpha cells is not related to sugars, it is related to some other hormones. Pancreatic beta cells, they sense blood glucose spikes and release insulin into circulation. Glycogenesis is excess glucose stored in liver and skeletal muscle, which will be broken down later if you do fast tomorrow, or if you go into a chronic stage where you don't get food for at least 6 to 8 hours. This is the glucose that will be broken down for energy. So these are done by liver cells, muscle cells, and to a certain extent, some are stored in blood as well. Lipogenesis, chronic excess of glucose converted into triglycerides and abdominal fat. And this is the reason why excess of sugars makes you obese or fat. So this is the insulin pathway lock and key mechanism. So if you can see the entire slide, pancreas produce insulin into the bloodstream. Insulin then acts as a key and helps glucose to enter every cell in the body. So basically, insulin is the most important factor how the glucose in the body can be utilized. There are certain GLUT4 transporters on the cell surface that सारे organs के cell के surface पे होते हैं that allows extracellular glucose to enter these organs like skeletal muscles or adipose cells, that is fat cells, and these are then converted into energy or ATPs. If there is optimum, you will feel energized. If there is excess, it will be converted into fat. And when this happens, when the lipogenesis happens or when the fat accumulation happens, that is where there is called a sugar downstream, where you eat something very, very sugary or meetha or some, for that matter, any khana for that matter, which is rich in carbohydrate. There will be an insulin spike. You will feel utmost energy and then you will start feeling lethargic. Then you will feel sleepy. You wouldn't want to study. You wouldn't want to work. You wouldn't want to attend anything. That is where your lipogenesis happens. That is your fat accumulation happens. So keep fasting blood sugar tightly regulated between 70 to 99. That is fasting blood sugar. Postprandial or after eating के बाद 2 घंटा के बाद when we measure, it should be less than 200. So this is when you know that there is optimum level of carbohydrates or sugar inside your body. If इससे ज़्यादा आ रहा है, that means most of the sugar is getting converted into lipogenesis, and that is when you understand that you're going to heart disease or diseases, atherosclerosis, or obesity for that matter. Understanding insulin resistance. So nutrient overload, receptor desensitization, and hyperinsulinemia. Chronic high sugar diets and excess visceral fat cause accumulation of intracellular lipids. That is your LDL, HDL, and triglycerides. So अगर बहुत ज्यादा शुगर डाइट या फिर कार्बोहाइड्रेट डाइट है, any cholesterol biomarker, or if you go through any LFTs, your lipid profile will show increase in all these three. Receptor desensitization. Cellular receptors stop responding to normal insulin levels. GLUT4 translocation fails to occur efficiently. This generally happens because of pancreatic cancers or PMOs or PCOS or diabetes mellitus 1. So this happens basically because you have inherent pathology. GLUT4 translocations fail. These are one of the most strongest translocators, by the way. If they are failing on a cellular level, then there has to be another pathology. So this is not related to what your lifestyle is. This is basically related to some other systems not working fine, is what is creating the GLUT4 translocation to fail. Hyperinsulinemia is basically pancreas secretes increasingly higher insulin doses to push glucose into resistant cells, leading to beta cell burnout. And this is one of the most trademark factors of PMOS or PCOS. Almost all women who come with this complaint will have hyperinsulinemia, increased hair on facial hair and body hair, abdominal or visceral fat, and or they will say that I work out a lot, मैं बहुत जिम जाती हूँ, खाना भी नहीं खाती, but then also I have problem in losing weight, and amenorrhea or irregular periods. Mostly starts from the age of 16 years, but since the lifestyle of the present generation has been drastically downsided. Even 40-year-olds are coming with this problem. So this is basically a metabolic syndrome. And with the amount of people who are getting, women who are getting increasingly diagnosed, it is probably not even a metabolic syndrome, it's a metabolic epidemic now. So this is the blood glucose reference range. I think this is more commonly associated by everyone than hypertension. Hypertension everybody knows 120/80 होता है, उससे ज़्यादा है तो hypertensive है, उससे कम है तो नहीं hypertension है, normal है. But as I said, there are certain ranges, but I feel like fasting blood glucose and sugars and everything, everybody knows and how to read this parameter the most easiest. So 70 to 99 is normal, as discussed. Pre-diabetic is 100 to 125, and 126 or higher is diabetes diagnosed. 200 or higher, diabetes diagnosed. This requires chronic treatment when you have to take metformin or sitagliptin or voiglimon or all these drugs is when you go into medications. This is the part where it is reversible, wherein you go into lifestyle modification. Cut down sugar, strength training thrice a week, cardio twice a week, and carbs less. These are basically three of the most defining factors of reversing your pre-diabetic condition. And almost everyone who stringently follows this comes up with a reference range of normal blood sugar in almost 3 months. What is HbA1c? So HbA1c is the 3-month glucose memory. Glucose in blood non-enzymatically binds to hemoglobin inside red blood cells. Any RBCs or any blood cells require 120 days to regenerate. So there is something called spleen in our body. It is called the graveyard of RBCs. So as I said, the human body is the best creation of God. जब हमारे आरबीसीज को लगता है हमारा काम खत्म हो गया है, वी आर कंप्लीटली टायर्ड, वी आर ओल्ड, 120 days में they themselves go into the spleen and they die. This is why spleen is considered the graveyard of RBCs. Then regenerate bone marrow से होते हैं छोटे छोटे nascent RBCs. They are like baby RBCs. They take around 60 days to mature into proper RBCs. So जब तक ये डाई करते हैं तब तक आपके बॉडी में न्यू आरबीसीज आ जाते हैं. That is why people who have anemia, they are given iron and folic acid for 3 months. उसके बाद फिर एक blood test. Because it takes 3 months for the RBCs, the nascent RBCs to come into your bloodstream. That is why HbA1c is called a 3-month glucose memory, is because they give you a ballpark range of how much glucose RBCs were carrying for the past 3 months. So even if you are coming with a FBS of say 100 and you are a pre-diabetic, but your HbA1c is let's say 5.5, so you were recently diagnosed as a pre-diabetic. That means इससे 3 महीने पहले तक your lifestyle was particularly very good. Nothing of that sort that could have made you pre-diabetic. But there has been certain changes in your lifestyle or certain chronic stress in your lifestyle or probably certain health habits that you have developed, जिसकी वजह से your FBS is coming into pre-diabetic. So here what we are going to do, we are going to give you lifestyle modifications. We are not going to give you medications. This is how a physician understands a patient. And this is why every patient does not require medication. Certain patients just require health and lifestyle changes and certain counseling. This is why it is very important for you to read your reports more than a physician for them to read a report. Because you have to understand it ki the work or the medications or lifestyle changes are your predicament. It is something that you have to do consistently over a really long period of time to actually be healthy, and that is your health that is in question. So this is how you will understand that 3-month glucose memory and HbA1c and how it is related to your RBCs, because RBCs take 120 days to regenerate. So every type of ailment that is related to your blood, they will give you 30, or they will give you around 3 months or 120 days to again assess yourself. Macro and macrovascular complication of diabetes. So retinopathy, that is your eyes; nephropathy, that is your kidney; neuropathy, that is your nerves; and heart, cardiovascular disease. Everything is related to diabetes. So there will be microvascular damage to retinal capillaries. That means your vision, or there will be vision loss, or you will be a risk factor for early onset cataract or glaucoma. Nephropathy, that is glomerular membrane thickening or protein leakage. That means your kidney will go into AKI, that is acute kidney injury or acute kidney failure. Neuropathy, peripheral nerve damages causing numbness, tingling, and non-healing foot ulcers. Cardiovascular disease, that is twice or quadrupleized increased risk of coronary artery disease or ischemic stroke. So this is what happens if diabetes is not reversed from the pre-diabetic stage and you go into diabetes, and then you go into uncontrolled blood sugar, not taking medications, not doing lifestyle changes, not doing the work, and then you come up with these problems. And these problems are where reversing these problems is next to impossible. So this is what where you have grown into chronic medication. And sometimes iske baad bhi there is no certain improvement. So this is why the risk of not developing this, the need of not developing this, is where you understand ki pre-diabetes ke stage se hi we have to start changing our lifestyle, changing our work, doing the work, so that we don't reach the end organ damaged stage. Cholesterol and lipids, demystifying blood fats. So, essential biological roles. Cholesterol is not a poison, it is a vital waxy lipid required for cell structure and endocrine signaling. So, fat is basically required for your hormones synthesis and bile acid synthesis. Bile acid is basically removal of toxins from your body. These two are essentially very important for your body to function. So, fat at an optimum level is definitely acceptable. But when it goes into extreme visceral fat, or when it starts coming under your skin, is where it is getting stored, and not and there is no need to store fat in visceral regions, and that is where you go into obesity. So these are the factors that any lipid profile will show you. LDL, HDL, and triglycerides. So if these are increased in your lipid profile, they systemically go into fatty liver. Fatty liver, say either it is atherosclerosis, that is your heart blockages are happening, or obesity also has a manifestation of causing liver and kidney damages. So that is why if any reports that you have, or any vital parameters, biological markers of high LDL, HDL, or triglycerides is considered bad, because that means the metabolic dysfunction and carbohydrate overcompensation is happening in the body, and that is why there is a lot of visceral fat and you're going towards obesity. And obesity is never a good thing because it is damaging your liver, kidney, as well as your heart. So atherosclerosis that I discussed, it is important for you to understand atherosclerosis from the point of view of MI, because it is also related to fat metabolism and, as we had discussed, BP. So these are probably the arteries. This is a fat globule. The space between the arteries are increasingly damaged because there is a lot of fat overcompensation, to an extent that it causes a blockage. Now, what happens if there is a blockage? Plaque formation, that is fat का एक globule बड़ा हो गया है एंड एक आर्टरी को ब्लॉक कर रहा है, दैट मीन्स इज दैट कि ऑक्सीजन वाला ब्लड विल नॉट बी गिवन टू योर vital organs. And when this happens in the most important arteries of your heart is where you go through myocardial ischemia or heart attack. So this is the easiest way of explanation, because when I say all the medical parameters that I'll be reading right now, you will not understand why people have heart attack unless and until you understand that it is actually the cholesterol globules that are biomarkers which are increased, जिसकी वजह से there will be a blockage in probably an essential artery and it is going to damage that particular pathway, and then it is going to cause an end organ damage which might be the heart, and in organ is organ ki wajah se might we have to probably might go into heart attack or stroke. So there will be endothelial injury, that is high bp, smoking or glucose damage that are probably there in the arterial lining, ldl infiltration or triglyceride infiltration, that is this plaque. Small dense LDL enters a subendothelial space. This space, foam cell formation, macrophages engulf oxidized LDL. Lot of medical language, forget that. Basically, ये बढ़ते जाएगा, बढ़ते जाएगा, बढ़ते जाएगा. There will be a lot of signaling from a lot of RBCs in your body कि यहाँ पर कुछ blockage हो रहा है, to an extent that ये पूरी तरह से block हो जाएगा. And अगर this happens in the aorta, let's say if it happens in the aorta, what happens? This is one of the most important arteries of your heart. If it happens in your aorta, your oxygenated blood will never reach out. And that is where you go into myocardial infarction. This is what cardiac arrest is. Many people say, what is cardiac arrest? क्यों heart fail हो गया? Heart fail कभी नहीं होता, heart block होता है. There is nothing that comes into heart failure. Heart cannot fail. Heart is doing its job. When it is the triglycerides or LDLs that block these pathways is when you go into a heart block. And agar heart block ho gaya, that is when the muscles start stiffening and your heart goes into arrest. So heart failure is one of the words that I completely do not like when people come and say, because most of the time it is actually the patient or the lifestyle or the inherent pathology of the patient that forces the person going into a heart failure or stroke. It is never the failure of the organ in general. So this is the reason why fat or lipids and BP both are considered very much related to your heart, is because MI or stroke ka the amount of people who come with MI and stroke right now, they come very low of age, that is 40 to 50 years. So even pehle people used to consider 50 to 60 years as a common factorial that heart attack or stroke ho jayega. But now even people at 35 years of age are getting stroke and MI, which is extremely disheartening and very much triggering also, because there are so much lifestyle modifications that the present generation requires to not go through atherosclerosis in certain early age. So this is basically the lipid profile, reference ranges, and risk stratification. So this is total cholesterol, LDL, HDL, triglycerides. These are the reference ranges. This is optimum. This is borderline. That is reversible. Reversible matlab lifestyle modification and medicines to a certain extent. And this is high risk, is where you start developing metabolic diseases like ALD or MI or PMS or something like that. The big picture, that is metabolic syndrome concept. So metabolic syndrome or syndrome X, that we call as a medical professional, syndrome X is a cluster of co-occurring metabolic abnormalities that exponentially increase cardiovascular and diabetes risk, seen in high blood pressure, elevated glucose, dyslipidemia, and central obesity combinedly, that cause cardiovascular mortality increases around 2x to 3x time. So BMI not considered one of the vital parameters now. I just want to say that. Now we are taking waist circumference or abdominal circumference and height. So height to weight ratio or your stature ratio is considered for your BMI. It is more acceptable than BMI because BMI is something that is very crude and is now not being accepted as a defining factor for putting a person into a metabolic syndrome or cluster X risk category. Metabolic syndrome diagnostic criteria. So this is basically what I was talking about. Waist circumference more than 102 or 88 centimeters in women. Elevated triglyceride, HDL cholesterol, elevated blood pressure, elevated fasting glucose. So everything together will make you a risk factor for metabolic syndrome. So it is not just one vital parameter that you have to see. It is a combined effort of all the body going into organ and damage that will cause you metabolic syndrome, or for that matter, any heart pathology, kidney pathology, stroke, anything. Anything that happens in our body, just one thing will never be deranged. There will be a cluster of other pathological biomarkers that will be deranged, which will give you a common manifestation. So the vicious cycle, high BP, sugar and cholesterol. So high sugar stiffens vessels, as I told you. High BP damages endothelium, the cascade or the plaque that we discussed, the same thing that is being discussed here. Placing arteries under siege, that is blockage. So this is how everything in our body is related. The target organ damage cascade, that is heart failure and MI, stroke and dementia, end stage renal disease, blindness and ulcers. These are all organ damage. These are end stage diseases that will be manifested if we don't go to the subclinical stage and cause reversible changes in our life. Prevention, lifestyle as primary medicine, as I've been discussing, reversibility of early metabolic disease is only possible with pharmaceutical management of symptoms, but targeted lifestyle interventions that change the root cause of whatever metabolic dysfunction a person is facing. Insulin sensitivity restoration, that is exercise and calorie deficit. Arterial elasticity improvement, that is nitric oxide boosting reduces vascular resistance, that is taking supplements like magnesium, fish oil, shell cal or calcium, B12, vitamin C. These are all nitric oxide boosters. Lipid profile normalization, that is fiber and fat quality shifts, that is you have to take a mixed diet of more legumes, more um, you have to take more green leafy vegetables, legumes, and badam, akhrot. These things are healthy fats. Okay, even if you're choosing to eat a lot of fats, try to take it from sources which is fish, probably eggs, probably almonds, probably all the nuts that are available. Those are having healthy fats rather than going for maida or white butter or certain things that are available on Blinkit and certain things are available on market. Try to avoid a lot of things that have a lot of polygenic fat. Try to differentiate between good fat and bad fat and take a balanced diet. Anyways, as a physician, I always tell that a balanced diet will have always less carbohydrate and less fat and more protein. For me, that is what is a balanced diet. But obviously, everybody has their own religious or spiritual or any other manifestations. From for that matter, in India, it is very difficult for any doctor or any physician to actually tell कि किस type का balanced diet किसी को acceptable way में लेना चाहिए. But for me, it is always कि carbohydrates and fat should be the smallest portion of the plate, and protein should be the highest. So that is what I prefer. Nutritional medicine, low glycemic and DASH diets. So as I said, balanced diet. DASH diets are high potassium. These are basically given to hypertensive patient. That is DASH का मतलब होता है dietary approach to systemic hypertension diet. So these are hypertensive people. They go through these DASH diets. जिसमें ग्रीन लीफी वेजिटेबल्स ज्यादा होते हैं, पोटेशियम वाले सब्सटेंसेस ज्यादा होते हैं, मैग्नीशियम कैल्शियम वाले सब्सटेंसेस ज्यादा होते हैं, ताकि देयर इज लो सिस्टोलिक एंड डायस्टोलिक ब्लड, and lot of fiber, lot of good fiber that is consumed by a lot of people. It not only helps in constipation, it also helps in throwing out toxins from the body. So nutritional medicine is an upcoming nutrition medicine, or nutritionists are upcoming branch. People are very much interested in all this because metabolic syndromes and metabolic X factors are increasing so much in society that physicians is other people are going into nutritional medicine specialists, because it is important that lifestyle and diet के through ही आप अपने health को better करो rather than going into pharmaceutical or tablets. So that is why it is very important to understand why balanced diet is so much of a prerequisite for your health. So exercise as a prescription, aerobic and resistant training, as I said, cardio and strength training. And if people have joint pain or some sort of ailment in your bones, walking. For stress, yoga or breathing exercises. डेस्क जॉब्स बहुत ज्यादा है तो टेक 20 minutes ऑफ ब्रेक, एक चक्कर काटो रूम का, डोंट सिट chronically at one place. These are basically almost every modular manual will have nowadays, because people are so much interested in health that almost everybody knows what they have to do, what they need to do. It's just that the need to do it is not strong or motivation enough to make them do it. Sleep, stress, and cortisol. That is, your sleep hormone and your cortisol is very much related. So, manage your stress. That can only happen when you're surrounded by good people, positive factors, family members, friends who make you feel comfortable, and restorative sleep. That is, aim for around 7 to 9 hours of continuous sleep. Stop using phones at night or laptops, or the impending thinking of future, because you don't control it. So there's no point in thinking about it. So these are the diagnostic and screening frequency matrix. Basically, let's go through it fast. Blood pressure weekly at home or every doctor visit, it should be target metric goal should be less than 120/80. Every 6 months or annual fasting blood glucose 6 months में every time एक बार एक टेस्ट कराना है fasting blood glucose का. This should be the reference. Lipid panel annual, that is 1 year में at least LDL should be less than 100, triglyceride less than 150, fasting insulin and HSCRP annually 1 year में. Insulin should be less than 6 and CRP, basically that is infection marker, should be less than 10. Key takeaways or daily actionable rules: tests, don't guess. Very important. There is a reason why biochemistry or biochemical markers are said to be the earliest sign of anything going wrong in your body. So whenever a physician tells you to get enormous amounts of tests done, it's not basically their predicament. It is because they want to know what your health looks like. Eat whole foods, move daily, and prioritize recovery. So this is the end of the session. I'm sorry I went ahead 10-13 minutes on your Sunday, but I hope you understood what I was trying to explain, and that you understand what the iceberg phenomenon, and at a subclinical level, try to reverse almost all your problems. Get a full body checkup done. If not, get it annually done. If you are in the risk factor, get 6 months. That's it. Thank you very much. Okay, does anybody have any questions, or we can end the session?
Thank you, Dr. Komal, for this amazing session. And thank you. It was very insightful. I hope everyone found the session to be very knowledgeable. Is there any doubts or questions so that Dr. Komal can walk you through any tips and tricks for your own health? You can go ahead and ask the questions, or she'll help out with it.
Hello. Sorry if it is discussed earlier. I joined only late. What is the importance of vitamin D in the overall health management? Should we take regular supplements or
Yes. So
thank you?
there is a uh, part in our body called parathyroid hormone. So that is very much related to vitamin D and calcium. So people who have, if you have gone through a body checkup where they have told you that आपको हड्डियां आपकी कमजोर है और body mass index आपका थोड़ा कमजोर है, so they generally give you a supplement of vitamin D and calcium. That is because the parathyroid hormone, which is actually regulating your osteogenesis, that means आपके जो हड्डियों को cells बनाते हैं, उसका रिस्पॉन्सिबिलिटी ये पर्टिकुलर ऑर्गन उठाता है, इसको रिक्वायर्ड होता है विटामिन डी एंड कैल्शियम बोथ, सो दैट कि ये आपके बोन्स के सेल्स को रीजेनरेट कर सके. सो ए डी ई चार विटामिन ऐसे होते हैं जो कि आपकी खुद की बॉडी जेनरेट नहीं कर सकती है, ये आपको बाहर से ही लेना पड़ेगा. दैट इज विटामिन A, D, E, K. दैट इज वाई दीज आर एसेंशियल विटामिन जो कि आपकी बॉडी जनरेट नहीं कर सकती है. तो इसी के लिए फार्मास्यूटिकल हैज कम अप विद दीज टैबलेट्स ऑफ शेलकैल एंड विटामिन डी सप्लीमेंटेशंस, ताकि जो कि रिक्वायरमेंट है बॉडी को वो जनरेट नहीं कर पा रहा है, तो उसकी वजह से आपके सप्लीमेंट्स लेने पड़ते हैं. दिस इज वेरी मच इंपॉर्टेंट फॉर योर ओवरऑल बोन हेल्थ. So it is very much important that it is an essential vitamin that you have to take with calcium. Vitamin D alone is not going to help your bone health at all. If you are taking calcium as well as vitamin D, probably 3 months to 4 months mein, your body mass index is absolutely going to increase. So yes, my answer is very much vitamin D is absolutely required because आपकी खुद की body वो generate नहीं कर सकती.
Thank you. Thank you.
Okay, Sampanna, I think if there's no other doubt, I think we can let everyone enjoy the Sunday.
Thank you, Dr. Komal. It was very useful session, and thank you everyone for joining the call and making it a successful call. I'll be sharing the recording as well. If you have any doubts or anything, you can go to the session once more. Thank you, everyone. Thank you, Dr. Komal, and have a nice Sunday evening. Bye, bye, everyone.
Bye bye.
Madam, please share the recording. Okay. Thank you.
Sure, sure. I will be sharing the recording.
Yes.
No worries.